Struggling with back pain, disc bulges, or sciatica? Do you want to understand the root causes and discover effective treatments without jumping straight to surgery? Let's break it down. Hi, I'm Dr. Charlie Oliver. I'm a chiropractor and a physical therapist practicing in San Antonio, Texas, where I combine the best of both professions to help my patients. And this channel is dedicated to helping you by sharing my experience from the past 2.5 decades treating back pain, neck pain, sciatica, headaches, almost every musculoskeletal condition you can think of. Today, we're going to be diving into the causes and treatment for herniated discs, disc bulges, and sciatica. We'll also explore how a combination of physical therapy and chiropractic care can help you find relief and prevent long-term problems. First of all, let's talk about what's happening inside your low back. For better or worse, we need to talk about the anatomy of your spine, specifically of the disc. So your spinal discs are like shock absorbers between your vertebrae, and they're made up of two parts. The soft inner part is called the nucleus pulposus, and the tough outer part is called the annulus fibrosus. Think of the nucleus as a water balloon, and then surrounding the water balloon are these fibrous rings keeping it in the right place. Now, when these discs are healthy, they cushion your spine. But when the nucleus, the water part, the water balloon pushes out, or in other words, herniates through the fibrous rings, you get a herniated disc. That can put pressure on the nerves and cause pain down into the leg. Now, if it's off to the side, it's definitely going to cause that sciatica, or if it's straight back, it may just cause a localized low back pain. I'm going to narrow this down to the 3 things I've seen in my practice that help herniated discs more than anything else. These are the approaches that I've seen provide almost miraculous relief to my patients, which actually makes my job a lot of fun. The first of these is a McKenzie Method. Now, the McKenzie Method, it was created by a New Zealand physical therapist several decades ago, and he proposed that the nucleus behaved like a water balloon sitting between 2 plates, which explains why most people, they herniate their disc with sitting or with bending forward, because that nucleus gets pushed backwards. So yeah, you're lifting something up off the ground, or when you sit and you lose the arch in the spine, those plates are coming together in the front, gapping open in the back, and that disc is getting pushed backwards. Now, this approach is taught to most physical therapists even in school, and I'll attest that when this approach works, it really works. As a matter of fact, my first week in practice as a physical therapist, I had a patient who was in intense pain. She had had a brand new disc herniation. Maybe you've been there. This woman, she was sweating, she was crying, she could barely walk down the hall, barely even lie down on a table without excruciating pain. So along with that, because a disc herniation was off to the side, her spine was tilted in the opposite direction. So that causes, essentially, think of it, the bone above the herniation is now tilted away from where the herniation is. Treatment with this method is to bring the spine above the herniated disc backwards and over in order to push the nucleus back to the center. I remember being really afraid to hurt her, but I knew the treatment to shift her trunk to the opposite side would help her out. It's literally a mechanical, forceful pull where you're bringing the opposite side of the body, the upper body, back to where it belongs and then overcorrect it. So as I tried doing this to her, she screamed, and of course it was about my 4th day on the job, and I was really scared that I was going to make her a lot worse. Now, I remember going to my boss and I asked him, what do I do next? He basically shrugged his shoulders, said, push harder. Well, okay. So that's what I did. And after that initial excruciating pain and her probably screaming, I don't remember all the details. I remember being afraid though, but she straightened right up. Her spine was perfectly vertical. The pain absolutely went away. After that, we started working more on the extension or the backward bending to keep the disc in the right place. Now, this is a perfect setup for success with this approach. It's with bending forward or sitting, making that pain worse. And we can use a McKenzie Method. And when a McKenzie Method works, we're going to find that backward bending helps that person become pain-free, and it should be pain-free for that method to be successful. Now, the technique I actually use more often than the McKenzie Method, what I really use on a weekly basis, is called Chiropractic Biophysics, or CBP for short. And what that's about is we analyze the exact shape of the spine to really figure out why the person has a herniated disc in the first place. So when we take x-rays from the front view, we need to make sure the spine is straight up and down. That's kind of a no-brainer. You can imagine if the spine spine is deviated to one side or the other, there's going to be asymmetrical wear and tear on the disc. The side view of the spine is actually even more crucial. There needs to be a very specific degree of curve in the lower portion of the back, especially between L4, L5, and S1 to keep the nucleus in the right place. So as you can imagine, most people with herniated disc lack the proper amount of that curve that I'm talking about. I can't emphasize enough to you how important it is for you to see a chiropractor who uses this technique if you have a herniated disc, a bulging disc, or even just generic low back pain. Because if we don't correct that misalignment, namely the lack of proper lordosis or curve, the problem always comes back every single time. And each time it does, it gets worse and worse. So you may go from having just localized back pain, and then a year later, it's starting to go down the leg, and a year after that, just excruciating pain that we can't even fix. Now, after that, the third tool I love is a decompression table. The decompression is like a next generation traction table. So it gives a very precise, very gentle pull in what we call the axial plane, or stretching in this position, which quite frankly is something in chiropractic we don't really do. We're mobilizing and adjusting the spine in different positions, but the decompression table has a very specific pull so that it basically separates the vertebrae from one another very gently, but that creates a negative pressure on the disc and helps pull the disc inwards. So when I have someone with a herniated disc, especially with sciatica symptoms, and we get them on that table and they get relief, it's a joy for me to hear it, and it's obviously a joy for them to experience it. Now, besides doing all of these things to help your disc, it's not a complete conversation if we don't also cover the activities and exercises that exacerbate disc pain. Namely, this means you've got to be vigilant in keeping that natural arch in your low back while you're sitting and during exercise, even when you're just bending over to pick something up off the floor or tie your shoes. These activities can undo your progress very, very quickly. So you've got to be very cautious all the time until that disc is completely healed. So the bottom line is understanding the causes and treatments for herniated discs, disc bulges, and sciatica. It can empower you to take control of your back health. Incorporating the right exercises and seeking appropriate care can help you alleviate the pain and prevent future issues. Take it from me, your chiropractor or physical therapist loves seeing you get better with their care, and I really take it personally when the treatment is only temporary. So I don't want to see that either. So we don't want to see you make a bunch of progress and then you bend over one time or you do something silly at the gym and have to come right back. Now, if you found this video helpful, make sure to hit that thumbs up and subscribe for more tips on managing back and neck pain, and check out our other videos. They're geared at helping you live a pain-free life. Drop me a comment below if you have specific questions or would like me to cover a different topic in the future. As always, have a wonderful day. See you next time.